Good afternoon to all. My name is Dr. Salil Mahajan. I am a consultant neuro and spine surgeon working in Wellmed Hospital, Dehradun. Today, I will share brief information regarding the seizure disorder and the medications available and other modalities which are available in the market. So, when we hear the term seizure and epilepsy, so this term is being tabooed in the society to many people, which is not good gesture by us to those people. In epilepsy, what happens is the electrical balance of the brain it become imbalanced. So the when the neural conduction there is in neural conduction generally what happens is the signal travels in one direction. But what happens is when this signal in simple terms we can say there is electrical shock or what do we call it? There is being electricity imbalance. So what happens is the brain has some chemicals in it. So when the concentration of these brain chemicals or neurotransmitter they decreases in the brain, it results in the electrical short circuiting in the brain, which we externally visualize as seizures or epilepsy in the patient. So during the episode of seizure, what should not be done? I will share some few points that the patient, we should not try to thrust in socks or some cloth or any material inside the mouth of a patient. We should try to smell the socks or a shoe to a patient. We should ideally, the patient should be placed in a open space so that while having episode of seizure he or she should not fall down and sustain injury to him or herself. So the patient should be placed in a left lateral position so that any secretion like the frothing from the mouth it should not go inside the chest of the patient, it should come out. And the patient, we should not try to restrain the patient, we should wait for seizure episode to end, generally which last up to seconds only. Sometimes in status epilepticus, when the seizures are not stopping, we should immediately take the patient to the hospital. Else, this episode generally stops on its own in few seconds. Also, I would like to mention the patients who are taking medications for this epilepsy, the timing of the medication and the company and the duration of the medication. It should be decided by a neurologist or neurosurgeon, and the drugs should be taken on the same time and the same composition. It should not be stopped on its own and should be done only under the guidance of a trained doctor. Also, the people who are taking anti-epileptics, they should take it as they are taking medication for diabetes. For means what I'm trying to say, we should not add taboo of taking these medications with the patient. We are not sabotaging any patient taking diabetic medication, but for epilepsy, we are sabotaging that this behavior of society and us should be changed. Also, the patient who are taking these anti-epileptic drugs, they should follow that they should take healthy diet. They should avoid taking alcohol, smoking, or nicotine, any form of drug they should avoid. They should have a healthy lifestyle. They should take 8 hours of sleeping because the lack of sleep is the target, or we can say it can produce the attack of epilepsy in such patients. So, 8 hours of sleeping is very much essential. Also, when these patients should not be left alone, someone should be with them because if they should avoid workplaces at heights, they should not be driving, they should not be swimming. All such activities should be avoided because by such avoiding such activities, they can prevent themselves and also the surrounding people. And there are many modalities available other than medications. So first, we should try to localize why the epilepsy is occurring. So 60% of the people who are being investigated for epilepsy, it is found that no cause, no identifiable cause is diagnosed in such patients. So such patients should take the medications for a long period of time because, as I've already mentioned, the neurotransmitter which are deficient inside the brain, we are giving that deficient neurotransmitter from the outside. So it is very essential to stop those seizures. So we should be patient with the patient, and patient should also be patient to keep taking these medications for a long period of time. For people who have an identifiable cause of seizure or epilepsy, there are various modalities of surgeries also available, which are beneficial for those patients, which can permanently end the epilepsy, or even it prevent the recurrence, or it prevents the further progress of disease.